all of the different aspects. I've put them into what I call the pillars of health. There's 7 now. There used to be 6.
So welcome to the TRT and Hormone Optimization YouTube channel. And as a guest today, we have with us Dr. Kyle Gillette. Is that right, Kyle? Is that a good pronunciation?
That is perfect. Better than I've heard many times. And thank you.
So welcome. So glad to have you. So maybe for everyone that doesn't know you yet, maybe give a short introduction of yourself. So what did you do for your education and your career now?
I'm a medical doctor and I'm from Kansas. I'm board certified in family medicine and obesity medicine. And I've experience in functional medicine, hormone optimization, aesthetics, fertility, and obstetrics. So a little bit of everything. Born and raised in the Midwest. And I've always kind of known that I wanted to treat patients holistically, body, mind, and soul. And it came apart that, as I practice, and even before I practice, I was very aware that hormone pathology was very common and that there was a very high demand for high-quality evidence-based treatment and not a very large amount of supply for that. So I've tailored my education thus.
Right, and that's something we all need nowadays in the Western world, right?
Mm-hmm.
So we're on the TRT and Hormone Optimization channel, so let's a bit talk about those topics, of course. As you might know, many men who are interested in optimizing their hormones are, of course, very interested in preventative and lifestyle medicine as well. So we really, most of us take care of our bodies, we take care of our nutrition or sleep quality, we pay attention to it. And of course, we make sure we do some kind of resistance training, as I've done for the last 32 years. So many of those men pay attention to all those things. But what other things do you believe are also important next to the things I've already mentioned? I know you're also a bit an expert in mental health. And how do you go about optimizing that specifically?
Yeah, I guess there's a lot of facets. One analogy that I make at times is that the body is a complex machine, and you need to find what the rate limiting step is for not just your hormone health, but your overall health. So sometimes that can be mental health or mindset or even spiritual health. Many medical doctors see this during end-of-life care or hospice comfort care, that a lot of what people concentrate on is their family, their social connections, even their metaphysical being or their self-actualization on Maslow's hierarchy of needs. That's why am I here, and what purpose am I doing in life, or what purpose did I live my life for? So those things can certainly make a huge difference and kind of cause a cascade of deleterious events that can lead to poor physical health as well. So you really need kind of all of the different aspects. I've put them into what I call the pillars of health. There's 7 now. There used to be 6. But diet and exercise are, of course, the first 2. And then sleep is the 3rd one. So I think that those are kind of the 3 most important. And it's wonderful that many people that are interested in health optimization do these 3 first. I often say anyone who is interested in health optimization is interested in preventive medicine. The first thing that Formula One pit crew chief will do is make sure that that preventive maintenance on the race car is done before they worry about tuning the turbocharger or whatnot. They do the preventive maintenance, rotate the tires, change the oil like any other car. So that being said, the last ones are sunlight, stress, spirit, and then I added social after I did Rich Roll's podcast because I did think that was worthy of another pillar. So all of these things can kind of cascade down into the first 3.
Right. And by sunlight, you're meaning being enough outside, the more exposure, the better. You know, you're talking to a dermatologist, right?
Yes. So that's a great question. And when I went on Doris Day's radio show, she's another dermatologist. That's exactly what she asked me as well. By sunlight, I just mean outdoors. So that encompasses heat exposure, cold exposure. Being indoors all of the time is not a natural state for a human. So, and perhaps just like the stress pillar, you don't want to have too much stress, but a little bit of stress where the effort will feel good, for example, in resistance training or learning how to make that effort of stress feel good. Conversely, you don't want too much sunlight and you likely do want at least some sunlight, even if it's just the sunlight that comes in your eyes at twilight in the morning and in the evening.
Mm-hmm. I know I have colleagues, dermatologists, that don't pay attention to preventative medicine at all. They're obese and they don't pay attention to their own health. But whatever, they're just saying to their patients, avoid all sunlight. You have a pale skin type, so you really have to put on sun protection factor 50 all day long. And then, of course, they have low vitamin D levels. And then they say, just take the capsules every day. So what's your take on that? Are capsules of vitamin D every day a good replacement of that sunlight pillar?
They don't replace a lot of the benefits of sunlight. For example, the sunlight in the eye. And yes, some people use the 670 nanometer red light to kind of improve the mitochondrial health of the cells of the retina. But there are many other benefits of sunlight. There's a disorder many people are familiar with, seasonal affective disorder. Sometimes I have a touch of this myself, actually. But it's where, especially in regions that don't get a lot of sunlight during the winter months, you can have essentially depressive symptoms, or you're not as vigorous and motivated as you are when you have more sun. So there's a lot more to sunlight than just vitamin D. Of note, if you're taking a lot of vitamin D, it can inhibit iron absorption, especially if you take it with calcium every single day. So menstruating females in particular are at risk of having low iron, partly due to this. And then there's also studies that correlate high doses of vitamin D with impairing melatonin signaling, and then also correlated with calcification of arteries if not taken with vitamin K2. So that's some of the nuance off the top of my head about vitamin D supplementation.
Mm-hmm. Okay, great.